Welcome to Design Domination, where you'll gain confidence, clarity, and a competitive edge in a crowded marketplace so you can dominate your competition. Hi, and thanks for tuning in. I'm Colleen Grotzer, and in this episode of Design Domination, I'm talking about health insurance for freelance designers. Stick around to find out some health insurance alternatives that you may not even be aware of that will actually save you money. Now, I felt compelled to talk about this because right now, since it's open enrollment time again, my husband and I are looking at health insurance options. And I really despise doing this every year. I really do. The company that he works for is actually only offered it for the last 2 years. And now the price has gone up. So we could just go with that. But the price is going up for us because of what the company's covering. That's changing. And so it's going to cost us much more than it did in the past. But other than those 2 years, we've had to get our own health insurance. And that's been almost 20 years for me and even more for him. So I have a lot of experience looking for health insurance. And I really despise a lot about the health insurance industry, but that is not for this episode. Health insurance is like something you hate to pay for, but you hate to be without it. And it's often a huge expense, especially if you're a freelance designer and you don't have the option to get insurance through someone else's plan. It can cost so much that you might feel afraid to go out on your own because of that. I know because when I went out on my own almost 20 years ago, that was what several of my colleagues mentioned as the reason for not working only for themselves full time. And the cost of medical insurance has, of course, only gone up from there. Anyway, if you are looking for health insurance as a freelance designer, there are some options that you may not be aware of, and they may be much more affordable for you depending on your situation. I recently compared a particular health insurance plan with a major provider against a health insurance alternative that had a similar deductible, similar options, and similar coverage. The difference was an astounding $850 a month. A month. That's more than $10K a year. So I really want to make you aware of some of these health insurance alternatives, but also what you need to consider with them. And I say that they're alternatives because they're not technically health insurance. They're called health sharing plans or medical sharing plans or medical cost sharing. The medical bills that you incur that meet their requirements, their guidelines, will be shared by the company. And then other members' monthly payments are used to pay for your bills and vice versa. Now, these types of plans are usually best for people that are in generally good health and aren't eligible for a tax credit based on income. And like I said, if you can't get insurance through a spouse, employer, or even a government program, and if you've missed the open enrollment period, because you can get these anytime, if you can't afford to or don't want to pay hefty medical insurance premiums, and if you only want coverage in case of a major health event. Health sharing plans usually require that you agree to or abide by a statement of faith or a code of ethics. They usually have some kind of guidelines to agree to. And not all of them are faith-based, but most of the ones that I found are. Their guidelines are about helping other individuals when they need it and vice versa, getting help when you need it, and then living a healthy lifestyle. Now, like I said, because it's not health insurance, you can also enroll at any time. You don't have to wait for the open enrollment period every year or a certain event to happen that would qualify you for enrollment at another time of year. So the way it works is that the subscribers, or they might be called members, pay a set amount each month, and that gets applied to the medical bills of other people in the program. This is similar to what you've come to know from insurance companies as premiums. And each health sharing company gives this their own unique name, and they might call it a monthly share amount, a monthly gift amount, or something else. And there's the option for you to give more money if you wish to help others in need. Because they have a code of ethics, which could be religious or otherwise, they usually don't cover any condition or illness related to alcohol or abuse of alcohol. If you smoke, you may not be able to get coverage at all, or you might pay an additional fee per month with your monthly payment. And most, if not all of the companies I looked at would not deny you for any health reason other than smoking. Some cover preventive and routine medical visits and checkups, and some do not. And some of them include prescription coverage and telehealth, telemedicine video calls. Most of the health sharing plans do cover pre-existing conditions, but they have special terms. So they might cover them after you've been a member for, say, a year or 2 years. And they also have their own definition of what constitutes a pre-existing condition. Most put a time frame for a pre-existing condition as something being 2 to 3 years back in your medical records. They may not offer any dental or vision. And if they don't, they actually might offer discounts. And some I saw have add-on plans for dental and vision coverage. What's great about health sharing plans is that they don't require that you use a certain network most of the time. They might have a network of doctors that they do consider to be in network. So if they do have a network, you would have to check their network of doctors and see if there's a certain one that you see, if you can continue seeing them, and then make sure that you're still covered, or if you might pay a little bit more to do so if they're not in that network. Now, some of the health sharing companies require you to ask your medical provider for a self-pay rate, a discounted rate when you go to the doctor. I mean, people who have health insurance, like conventional health insurance, they get a discounted rate already, and doctors know this. And then what happens is that they will usually have you submit your bills to them, and then they will, what they call, share them when they get to a certain threshold based on your plan. That may be a certain amount per illness or per incident, or it may be once you've exceeded an annual amount, similar to how a deductible works, in other words. Other companies may require you to have the provider submit the information to them directly, and then they will get the bills reduced on your behalf and then share the bills, if they should be shared at all, according to their guidelines. Now, you also have to check with each program to see if it counts toward any requirement for health insurance that your state may have. I also noticed that one of the medical sharing plans I looked into was not available in several states, so always check that too. Now, because they're not health insurance, technically, you may not be able to use an HSA with their plans. And if you have an HSA already, you could potentially contribute up to the maximum amount allowed prior to switching to a health sharing plan. But I would ask your accountant about this to see what they suggest. That's what I did anyway. Some health sharing plans may have a maximum amount that they will pay out per incident, illness, per year, or lifetime. And that's not unlike many conventional health insurance plans either. And some offer add-ons at a low cost that will increase these amounts. While a health insurance plan can potentially save you a lot of money in monthly payments and out-of-pocket medical costs, there are some things to consider when weighing the financial costs of medical insurance versus a health sharing plan. Now, application and admin fees are one thing to consider. But these are usually one time and they're usually minimal, but some companies charge them. One company I checked into charged a 12% administrative fee in the first few months. And then there's annual amounts. Some health sharing plans may have an annual amount that is similar to a deductible, but they call it something else. For example, one company calls it an annual personal responsibility. And what they call that varies by company. Okay, then they might have instead, or in addition to that, something that they might call a per incident amount. I know one company we looked at had a $1,000 per incident amount. So if your bills were less than that, they might not be shared unless other criteria were met. And again, this varies by company. And this is important because you could incur many costs per year that fall under that threshold, and those might not be shareable. But one company I checked into gives a 90-day time period for this, meaning that if you incur several bills within that time frame for the same illness, then they would share them if they collectively totaled more than the $1,000 or whatever that amount was. Now, if you take any medications, especially if they cost a lot, be sure to see what they cover for that. Now, something that you might not have thought about, and I didn't know about this until I brought it up to my accountant, is tax write-offs. Okay, and you'll need to ask your accountant about these. I'm not advising, I'm just sharing what I learned from a conversation with my CPA about my own situation. But you can usually write off your medical insurance premiums as a freelance designer, but you cannot write off your monthly medical sharing payments. And again, that's because it's not technically health insurance. So your monthly payments are not technically premiums, which sucks. So if you've paid a lot in premiums with conventional medical insurance in the past and written them off, you might actually end up paying more in taxes without that write-off. Now, when I asked my accountant about this years ago, the difference was not small either. Okay, it was more than $4,000. So you really do need to consider that, because that can make or break the difference that you would save between going with a health sharing plan or a conventional medical plan. But you may be able to offset that amount in other ways, maybe by contributing more to an HSA or to your retirement account or to your favorite charity. But again, you'd have to ask your accountant. At least that's money you get to keep for yourself, but put elsewhere, or donate it instead of paying higher premiums to the insurance company or throwing more money at the IRS. Now, I mentioned earlier that many health sharing plans are faith-based. There are actually a lot of options for Christians. The most popular ones, which happen to have been around for decades, are Medishare, Christian Healthcare Ministries, and Samaritan Ministries. I actually have a friend and a neighbor who have used Medishare for years, and they've been very happy with it. Now, my husband had it for a few years, but he didn't really need it. He didn't use it. So I can't say much other than my own experience. The application process was easy, and the people were very friendly when we asked questions. And from my research, I think the Samaritan Ministries plan was the only one that requires you to get a church leader to sign a form on your behalf. And then some other Christian health sharing plans that haven't been around as long are One Share Health, Liberty Health Share, Share Healthcare, NetWell, and Sedera. And I have links to all of these on the episode page. Now, if you're of the Jewish faith, there's an option called United Refuah. I think I said that right. And strangely, this was the only one I found. Now, there are a few companies that serve people of any faith, and those are New Health, KNEW, New Health, and Zion Health Share. I also found some non-faith-based health sharing plans too, and those are Universal, Sidecar, and Crowd Health. Now, something else to consider is because the monthly payments for health sharing plans are usually quite a bit less than a traditional medical insurance plan that you get on your own, you could potentially supplement the health sharing plan with a catastrophic or other type of insurance policy. So, for example, a few years ago, we looked into Cigna, Aflac, and United American. Cigna and Aflac offer supplemental insurance policies for cancer, heart attack, and stroke, and Aflac also has one for dental. And then United American has a critical illness protection policy for things like a major organ transplant, heart attack, stroke, total loss of eyesight or hearing, and end-stage kidney failure. These are typically lower cost, and they can provide financial support when your medical insurance or a health sharing plan doesn't cover something, or if you exceed what your benefit amount is. They often give you the option of a rider, which is like an add-on to the policy, which will increase the benefit each year or offer some other benefit. And some of them will actually pay you what's called a lump sum upon diagnosis, and then you can use that money however you see fit, whether that's for the medical care itself, or maybe you have to pay somebody to grocery shop for you if you can't do it yourself, or maybe you use it to pay for childcare so you can more easily go to your medical appointments. Whatever you do, though, when researching any health sharing plans, be sure to check out the guidelines like you would with any conventional medical insurance plan. And check out their reviews on Facebook to see what people have been saying. Check out their Better Business Bureau ratings and their reviews. I saw several health sharing plans that were rated A and B by the BBB, but they had horrendous reviews. Of any negative reviews that I saw, many reviews seem to be misunderstandings about the expectations of what would be covered. Some people seem to have not read the guidelines and expected things to work as medical insurance. And then other negative reviews seem to revolve around that company's business practices. But many of them had very positive things to say. I want to mention Freelancers Union, freelancersunion.com, because they are able to offer health insurance for freelancers. However, it's only available if you're in New York, New Jersey, Connecticut, or Pennsylvania. That may or may not save you something if you're still looking for a traditional health insurance plan. I really hope this information will be helpful the next time that you're looking for healthcare coverage, because I know just how frustrating it is. And at this time, I don't know which one we're going to go with, but if you do opt for a health sharing plan, or if you're already in one, I'd love to get your feedback in a comment or via email at colleen@creative-boost.com. If this content was helpful, you can support the podcast by buying me a coffee. It might actually end up being a glass of wine or some tea, but you could go to buymeacoffee.com/creativebooth.